Welcome back to Touro University Nevada YouTube page with the physical diagnosis hearing exam with the Rennie and the Weber test. This is more of just kind of a primer slash refresher for everybody. When we're talking about these two tests that test hearing loss, they both work within the conductive and the sensorineural zones. The conductive hearing zone is from the external ear into the auditory canal through the tympanic membrane, the malleus, the incus, and the stapes. Basically at the base of the stapes, where it attaches to the semicircular canal, that's where we see the conductive zone end and where the sensorineural zone begin. The sensorineural zone then contains the cochlea and the vestibular cochlear nerve. When we talk about air versus bone conduction, we want to remember that air conduction is almost always longer than bone conduction in a normal person. It's at a 2-to-1 ratio. Air conduction less than bone conduction is a sign of conductive hearing loss. We're going to run through these tests quickly on the slides, and then we'll actually demonstrate them on bones. The Weber test is started by activating the tuning fork, a 512 Hertz tuning fork, and then placing it against the patient's scalp at the bregma. Once you've done this, you ask the patient if they can hear the noise or the vibrations equally in both sides. This is looking for the patient to lateralize what their sensorial experience is. Here's a close-up of the Weber test, and you can see the bone conduction going down both sides. You will have some air conduction as well, and in a normal situation, it will be equal in both sides. When we're talking about a conductive hearing loss, though, because you don't have the input from the outside world, you can see this as I'm pointing with the base of my tuning fork right here, where we have loss of conductive through air, but we have adequate conductive through bone. Notice that it would be louder on this side because we've eliminated the sensory input from the external world. That would be conductive conductive hearing loss, and that is actually seen as lateralization to the affected ear. When we talk about sensorineural loss, we place the tuning fork at the bregma, and we will note that, as you can see here, where the cochlea is no longer functional, you'll have a louder experience on the good side. So sensorineural is lateralization to the unaffected side. Let's take a peek on how that looks on bones. This guy around, extreme close-up. Everybody, this is bones. So, the way we would conduct the test, of course, is that we're going to read our patient, inform them about the test. We're going to establish our rapport. You're going to hear a vibrating noise, kind of a high-pitched one, Bones. And I'm going to place this on the top of your skull. You're going to tell me then if you can hear it in both sides. Bones would then reflect to me if he hears it equally in both sides, or if it's positive to one side or the other. You don't have to let the tuning fork run out. You can stop when the patient has told you that they've had that sensory experience. Back to the slides. Let's let that adjust for the second. So again, on the Weber test, we're looking for that lateralization. If it's conductive hearing loss, it's going to lateralize to the affected ear. If it's sensorineural hearing loss, it's going to be conducted to the unaffected ear. So, when we talk about the Rennie test, we're going to use our 512 Hertz tuning fork. We're going to activate it by tweaking the prongs of the fork, or strike it against our knee. We place the base of the fork against the mastoid process and then ask the patient when the sound goes away. We then move the tuning fork in front of the patient's ears with the tines perpendicular to the ear canal. We activate it, hold it there, and then ask the patient when the sound goes away. In this image, we see that in normal, the bone conduction should be slightly shorter than the air conduction, with the air conduction being 2-to-1 ratio. When we talk about conductive loss, we can see with the cursor here, this area where we've lost the auditory canal, something is wrong with the middle ear. you'll note that our conductive loss demonstrates where the bone conduction will be longer than the air conduction. When we're talking about sensorineural loss, we're actually going to have, again, with the air conduction being slightly longer than the bone, but in this case it's going to be a significantly limited experience. We look here to then see that for the conductive hearing loss, bone conduction is heard longer than air conduction in the affected ear. This is considered a negative Rennie test. And for sensorineural, it's going to be air conduction heard longer than bone in the affected ear, but it's going to be less than that characteristic 2-to-1 ratio. The top set of illustrations here for conductive hearing loss and sensorineural loss are with the Weber test, noting that with the Weber, conductive hearing loss has lateralization to the ear with deficit. For the sensorineural hearing loss, lateralization to be to the unaffected ear, unless we have, of course, in either case, a combined hearing loss. So this is how it would look on bones. So again, I will explain to my patient what I'm planning on doing. I'm going to take this tuning fork, you're going to hear a high-pitched noise, and I'm going to place it up against just behind your ear. So we'll go on the other side so you all can see it, right against the mastoid process, and then ask the patient when they hear it go away. Normally I would do this on the side that I'm on. And of course bones would say right about there. I would then reactivate it, placing it again perpendicular to his ear canal, and ask him when that sound goes away. Remembering that during this test, the Rennie test, you're not going to actually stop the tuning fork's sound, because we're going to be in a situation that's different than when we do like a dermatomal testing or testing for the spinal tracts when we're doing sensory testing, and where we actually do that and then ask the patient, tell me when the vibration stops. That's going to be a totally different test. So thanks again for joining us on this quick review of sensorineural and conductive hearing loss. Have a great day.